The Citizens Technical Environmental Committee, also known as CTEC, and the Medical Monitoring Working Group panel of experts presents the 2020 Medical Monitoring Report with a virtual tour of the Residential Metals Abatement Program and the latest medical monitoring study. The focus of the Phase 2 Medical Monitoring Report is the blood lead study. The report also reviews Butte's Superfund history and associated risk assessments. In addition, the report reviews past Butte exposure and disease rate studies and examines community perceptions that Butte residents face significantly greater risks of disease than elsewhere in the state and nation. Butte is an interactive community. By watching this short video, we hope to gather questions or concerns about the Residential Metals Abatement Program and the related 2020 Medical Monitoring Study, which examined our extensive blood lead level dataset for trends. The Citizens Technical Environmental Committee, also known as CTEC, will be hosting a virtual panel to discuss the results of the study with the public. All members of the public are invited to attend and participate in the discussion. Please visit Butte-Silver's Facebook page to watch the live event on May 24th from 6 p.m. to 8:30 p.m. The panelists for the live event will be Dr. Bill McGregor, Joe Griffin, Dr. Rosalind Schoof, Charlie Partridge, Eric Hassler, Dr. Seth Cornell, and Lara Williamson. During the early stages of the Superfund cleanup, the EPA recognized that they would need to reduce human exposure to metals that were found in the numerous mine waste dumps scattered across the Butte Hill, but also located in people's yards, homes, and attics. As a result of these findings, 2 cleanup programs were initiated in cooperation between EPA, Atlantic Richfield, Montana DEQ, and Butte-Silver County. These 2 cleanup programs are the Butte Reclamation Evaluation System to cap mine waste dumps, and the Residential Metals Abatement Program to clean residential properties that tested high for lead or arsenic. Prior to the Superfund cleanup, barren mine dumps like these potentially exposed residents to elevated levels of lead and arsenic. Capping those dumps with clean soil and vegetation reduces exposure. To date, 178 mine dumps have been capped, covering more than 600 acres, with more capping mitigation efforts planned. More importantly, the Residential Metals Abatement Program, generally known as RMAP, evaluates yards, homes, and attics for lead, arsenic, and mercury. The program cleans up properties that exceed action levels for Butte. Years of study have shown that lead is by far the biggest reason for residential cleanups. Focusing on children and pregnant and nursing women with an elevated blood lead level is one of the targeted efforts of RMAP. Butte's RMAP program analyzes blood samples and focuses cleanups where there is a known problem. When an elevated blood lead level is reported by the health department or a pediatrician, RMAP technicians will assess the property where the child lives. If the child spends time at a family member's home, that property will also be evaluated. All sources of lead at a targeted property are then abated. Paint and lead pipes are only addressed when there's an identified elevated blood lead level. Lead exposure is common across the nation, particularly in places with older housing stock such as Butte. But lead paint and lead pipes are not covered by the EPA under Superfund. The RMAP utilizes a multi-pathway approach that will address all potential lead exposure sources at a property where a resident has an elevated blood lead level. RMAP is a comprehensive human health-based program that aims to sample all residential yards, homes, and attics in Butte priority soils, shown in the red boundary line, and abate those properties that exceed action levels. In 2018, the participating organizations agreed to expand the program to a large portion of the county at the property owner's request, depicted by the outer yellow boundary. Even with the expanded service area, RMAP uses blood lead data to prioritize properties to be sampled and abated within the boundary. As of December 2020, RMAP has evaluated 3,796 properties and has abated 1,602 yards, attics, or homes. Butte's residential metals abatement program is considered the gold standard for Superfund sites. Charlie Partridge, EPA Region 8 toxicologist. One of the most innovative and successful parts of the Superfund cleanup in Butte has been the residential metals abatement program. Dr. John Ray. As part of the residential metals abatement program, the EPA requires a medical monitoring study to be conducted every 5 years over the course of 30 years. The first 2 studies are now complete. Both studies have relied on blood lead data collected by the Department of Health. Focusing on children with elevated blood lead has provided Butte with a robust data set that is unmatched in Montana. As a matter of fact, for the first study, the scientists were unable to find a comparable Montana city. Each study included more than 2,000 samples for children between the ages of 1 and 5 years old. The Phase 1 study showed that over the study period, average blood lead levels in Butte children dropped dramatically from 3.5 micrograms per deciliter in 2003 to 1.6 micrograms per deciliter in 2010. The percent of blood lead levels above 5 micrograms per deciliter decreased from 34% in 2003 to 10% in 2010. By the end of the study period, average Butte blood lead levels were the same as those for a reference community, a community with similar housing stock and a population comparable to Butte. But the rate of elevated blood lead levels was still higher in Butte. The rate of elevated blood lead levels was higher in Uptown than in Flats. The Phase 2 study showed that from 2012 to 2017, 76% of the children tested had blood lead levels below the detection limit, while 7.4% of children had elevated blood lead levels defined by the CDC as greater than 5 micrograms per deciliter. At the end of the Phase 2 study, the rate of elevated blood lead levels was still higher in Uptown than in the Flats. No additional decline in elevated blood lead levels could be detected in the last 5 years, and more accurate analysis requires rapid confirmation testing. The Phase 2 study concluded that the residential metals abatement program has been effective and should be continued. Other key findings and recommendations included: additional clinical staff should be provided for the health department to support on-site confirmation testing for elevated blood lead. There should be greater outreach to parents, pediatricians, and expectant mothers to increase blood lead screening. Additional analyses of existing RMAP environmental data should be included in the Phase 3 report. Efforts should be made to improve public outreach and communication about Superfund-related health issues. The working group also recommends that it be maintained as an active group, meeting several times per year to facilitate implementation of the recommendations and to plan for the next study. Blood lead data are available for 2018 through early 2020, but no samples are being collected during the pandemic. The current plan is to include data for 2018 to 2019 and 2022 to 2023 in the Phase 3 study. The 2022 to 2023 data are expected to include more complete venous confirmation sampling, enabling the program to better understand the persistence of elevated blood lead levels in Butte. In addition to the blood lead study, the Phase 3 report will include reviews of other health studies conducted in Butte, including an update to the state cancer incidence studies. A review of any other exposure studies will also be included. Public outreach and opportunities for input will be continued. More information and the full reports on Phase 1 and Phase 2 of the medical monitoring study are available on the Butte-Silver County website. If you would like to provide questions and comments, please attend the Facebook Live event on Monday, May 24th from 6 p.m. to 8:30 p.m. on the Butte-Silver Facebook page, where a panel will be available to answer questions. Comments and questions can also be submitted via email to rmap@bsb.mt.gov. The Facebook Live panel discussion on May 24th will also be recorded for those who are unable to attend.